As we age, the effects of the sun's exposure and environmental pollutants take their toll on our skin's appearance. These damaging effects can cause our skin to wrinkle, develop sunspots, and look tired. World-renowned Dr. SHINN's latest Sciton skin resurfacing procedure can reverse these damaging effects and restore a healthy, new, natural look to your skin. Laser skin resurfacing is a popular cosmetic procedure that can help rejuvenate the skin and reduce the effects of the sun, aging, and some facial skin disorders. Treatments are safe, effective, and convenient. Also, the cost of cosmetic laser skin resurfacing is minimal compared to many other treatment options. Laser skin rejuvenation, or laser peel as it is often called, removes damaged outer layers of skin and stimulates the production of collagen and new skin cells in the underlying layers, bringing about smoother, younger, healthier-looking skin. A good candidate for laser skin resurfacing would be an individual with lighter skin tones because there is less risk of unexpected side effects, such as permanent skin discoloration.
This is ablative laser therapy, which means the skin tissue is lasered off. Skin tissue is lasered off and allow the new tissues to grow. Compared to the full face ablative laser therapy such as CO2, this is erbium laser, and this is very effective because it uses what's called fractionated method, meaning instead of having the entire area lasered off, we are making a tiny little pinprick of the laser holes into the surface. So there is healthy tissue surrounding the laser hole that heals really faster. So we do not have the kind of a downtime we used to have with the CO2 laser. But the effect is almost as good as a CO2 laser.
First, the patient's area to be treated is numbed. In this case, we are performing a total face and neck resurfacing. The patient is introduced to the laser.
And I'm going to be starting from your chin, and let's see how you feel about this. Very loud noise. Here it goes. How was that?
Sorry.
That's okay. Very good. Now we're going to change the settings. Obviously, the more you can tolerate it, the better it is.
The Sciton machine is set to the desired ablation and coagulation depth for either light or deep peels by Dr. SHINN. These parameters such as ablation depth and thermal effect can be individually adjusted to suit a patient's specific pathology, desired outcome, and tolerance for downtime.
About 15 to 20 years ago, the only method we had available was a CO2 laser. And that was very effective, but it had extremely bad downtime and long recovery time. It took off the entire layers of the face, so there was a lot of bleeding, oozing, and we had to do the regular burn treatment for the surface for at least 2 to 3 months before people had good results. So with newer lasers, we use what's called a fractionated system, which means instead of taking the entire surface off, we are making a small hole into the skin. Method called fractionation. And that has greatly improved the recovery time of the laser resurfacing of the face. And within those class of lasers called the fractionated laser, we have 2 different kinds. One is called non-ablative and one is called ablative. Non-ablative means it does not make any holes into the skin. So lasers such as the thermage or Fraxel falls into non-ablative laser class. What I'm using today is ablative, so it actually makes the hole. And we found that when we actually damage the skin in a tiny small fractionated fashion, it forces collagen growth much better. So people have not just the tightening of the skin, which is what you see with non-fractionated lasers, but you also see rejuvenation of the skin in better fashion. It forms more collagen, thus it plumps up the skin, and it helps with the wrinkles.
As you see, the laser beam wavelength or pattern scans the full area to be treated. The computer-guided scanner produces the ideal beam pattern for uniform and rapid treatment, along with consistent results. There are 2 approaches to resurfacing: full field and fractional. In full field resurfacing, the entire surface area of the skin is treated. A laser beam is scanned across the treatment area and precisely removes a layer of skin. The body will naturally replace the old, damaged skin that was removed with a fresh, healthy layer. Treatments can range from shallow, which might be appropriate for eliminating fine lines, sunspots, and tired-looking skin, to deep, which is often used to improve skin tone, texture, and eliminate deep wrinkles, even in difficult areas like upper lip lines and crow's feet. In fractional resurfacing, the laser removes pinpoint columns of skin, leaving the surrounding tissue intact. This approach allows the laser to penetrate very deeply for effective collagen remodeling, while the surrounding intact tissue promotes rapid healing. The ProFractional XC is most suitable for the clients who would like to see improvements in wrinkles, sun damages, any previous scars, and overall tone and texture of the face, neck, arms, and abdomen. ProFractional XC is also used for reducing stretch marks of the abdomen and other body parts. The procedure takes from 10 to 30 minutes, depending on the condition and the size of the area of treatment. Recovery time is minimal, and slight redness, possible swelling, and microbeam marks will usually disappear in 1 to 2 days in light treatment and 3 to 4 days in deep treatment. Have a smoother, more uniform skin appearance in a matter of a few days. To learn more about this revolutionary laser skin resurfacing procedure, schedule an appointment with Dr. SHINN today at Adonis Aesthetics.